So we'll move on to the next one. This is a military contractor. So we love this, right? Because there's a couple of things that have happened here. One, he had 10 days to treat. He was going overseas literally 10 days after treatment. So this was one of those things where we're not going to have as much data as we could, but we're still going to show benefits to you within 10 days of treatment. First of all, here's your assessment once again. This is showing damages in the very low to low with only one in the average, and that's visual memory. As a military contractor, visual memory is something that's trained all the time. So it makes sense that he would still perform well in that because there's been a lot of training and there will be a ton of resilience inside of that space. When you look down to balance, however, and this we do have baseline and post-baseline, within 2 weeks you're watching some very significant changes happen. And I want you to pay attention to path length, not necessarily percentile, because with only 10 days, he makes a jump from a second to the 14th percentile. That doesn't seem very impressive. But if you look at his path lengths from 161 centimeters down to 108, he's actually dropped his path lengths by about 35%. That's a huge improvement in balance. Although he still has a way to go, we were constrained by time and weren't able to do that. You'll see changes pretty much across the board here, with his standard being the only one that doesn't show a major change. However, if you look at his fall risk, he'll be at a very high fall risk before with a low fall risk 10 days afterwards. That's really powerful for us, and I'll see if we have anything more on this. So this is his eye tracking right here before, so 10 days before and then after. So you'll see actually some really great changes. We wish we could have had him for the full 4 weeks that we had really needed him for, but this is what we had him for. So his pursuits are at 21. He's got a 14th percentile pursuit. You'll notice the loss of tracking right there. If you look at his horizontal saccades, a good 80% of his tracking is not even on the target. That's really terrible. That's why he scored an 18 with a 13 percentile. His fixations are good, not surprising once again for a military contractor. That's one of those things that you're going to be trained for. Reaction time is good, target accuracy a little bit low. If I go down, you'll watch the improvements once again. So he's doubled his scores here in saccades. His fixations have improved by about 10 percentile. His pursuits stayed the same, but his score's gone up now from a 25 to a 32, which is a standard deviation higher. That's significant statistically. When it comes down to it, we're watching changes across the board that are not uncommon inside of our case studies and inside of every single one of our patients. There are a couple of times where we will have a patient who is a little bit more resistant to treatment. And it's not for the reasons you think. It's not for someone who had a concussion years ago. It's not time to treatment. That's not our problem. The issue is usually something like a stroke, hemorrhage in the brain, or in some cases a shunt that was placed with a concussion on top of it. Those structural changes tend to make a client more resilient. However, they get the same results with usually another round of treatment. So that's kind of what we're talking about with our case studies.